The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
Until just a few months ago, most of us hadn't heard of what's now being called superspreaders. But we'll hear tonight it's key to understanding the path cut by COVID-19. Plus, our Ontario hubs explain how internet access in Eastern Ontario leaves much to be desired. And from Nicholas Christoph to Barbara Emil, we've got the Agendas we can review. It's Friday, October 23rd. I'm Nam Kiwanuka, and that's all ahead on the agenda. A spin class in Hamilton, a wedding in Ottawa. Harmless in normal times, but in these COVID times, there are events that led to dozens and dozens of infections. What are superspreaders? With us to explain in the nation's capital, Rewa Dionandan, professor in the Faculty of Health Sciences at the University of Ottawa. And in the East End of Toronto, Ashley Chute, epidemiologist at the University of Toronto's Dalai Lama School of Public Health. Welcome to you both.
Thank you.
And actually, I got to say, I like you already because in the office, we have this East versus West, and anyone who's East is the best. So it's nice to have you on the show.
Awesome.
To get into the conversation, I just wanted us to look at some numbers. Sheldon, if you could, please. In a contact tracing effort involving over 3 million people in India, 8% of patients accounted for 60% of infections, while 70% of the patients infected no one. A study in Hong Kong found about 19% of cases were responsible for 80% of infections, while 69% of cases did not infect another person. And one patient, known as patient 31 in South Korea, infected, get this, more than 5,000 people. Rewa, that is astounding. We are 9 months into the pandemic. What have we learned so far about how this disease spreads?
There's something in the social sciences called the Pareto Principle. That's when the majority of consequences are caused by a minority of causes. That's what we're seeing here. So this disease isn't seeping homogeneously through the population. It's exploding in punctuated occasions. It's like, the old Breck, I think it was a Breck commercial, shampoo commercial. I told 2 friends, and they told 2 friends, and they told 2 friends, and so on and so on. If you're old enough to remember that commercial. Well, this is more like I told 2 friends, 1 friend didn't tell anybody, but the other friend told 5 people, and of those 5 people, 4 didn't tell anybody, but that 5th friend told 6 other people. So it's spreading in again, explosive, punctuated fashion, and we call this the super spreader phenomenon. That's what we're learning here, and it's unlike some other exponential growth experiences in that way.
And Ashley, why is it important for us to know how this disease spreads?
So I think Rewa explained that very well. So when we initially realized what COVID was and we're trying to characterize it, one of the first things that scientists talked about was something called the reproduction number. And that's the average number of new cases each old case causes. And for COVID-19, we think it's between 2 and 3. But we've learned that it's really, really variable. And so some people will infect a lot of people, and a lot of cases will go on to transmit to nobody or to just 1 or 2 other people. And that variability and understanding it is really important because it allows us to think about, how do we control it and how do we intervene in a way that captures the fact that a lot of cases are not going to transmit to a lot of people. And that, if we can understand this clustering of cases and how it transmits, we can potentially control this in a way that doesn't require these broad lockdowns and very sort of population-wide interventions that can be incredibly disruptive.
Since the pandemic began, we've been looking at the measure of how contagious this disease is on average, known as the R0. Does that measure tell the full story of how this disease spreads, Ashley?
No, it doesn't. And so that's where this over-dispersion comes in. And what that really means is it's a measure of sort of that heterogeneity. So it's a measure of the fact that most people are not going to transmit to a lot of people. And for the case of COVID-19, we know that this over-dispersion is the number for overdispersion is low. And what that means is that a small number of people are responsible for large amounts of transmission. And so when we talk about averages, which is what that basic reproduction number is, it doesn't capture that heterogeneity. And again, that's an important feature of the disease, and it's something that's quite different from flu. So flu is a disease that has a reproduction number of, again, between probably 1.5 and 2, but it looks different than COVID-19 because most people transmit to 1 or 2 people, and we don't have these super spreader types of events.
And how important is that to know? Because we've been hearing a lot about a potential twindemic with COVID-19 and the seasonal flu. How important is that to distinguish that now?
I think the important thing is really when we talk about interventions and we think about how we control this. The way that we responded in the spring was really based on the assumption that when we had a pandemic disease, it was going to look a lot like the flu. So all of our pandemic plans are based on that. And we've learned over the course of the past several months that this isn't the flu, that we can basically leverage this patchiness and this clustering. And we can use that information to better control this and to think about interventions that address this clustering and this patchiness. And again, we have to think a little bit differently. We can't just treat this the same as the flu.
And Rewat, has this understanding of super spreaders worked its way into how we understand COVID-19?
In a sense, what do we know now that we didn't know back in the spring? We know some things clinically. I'm not a clinician, but I'm told by my clinician friends we know better how to treat it at the hospital level. We know how it affects our biologies a little bit better. But epidemiologically, we understand it's a super spreading kind of thing. So as Ashley eloquently put it, now we know which levers to pull at a policy level, at a control level, at a public health level. And that's critical, because that means we have a path forward towards something resembling normality, absent a vaccine or a therapy.
I want to read an excerpt from on how Japan approached COVID-19, and this was in the Atlantic magazine. And they write, Hiroshi Oshitani, a member of the National COVID-19 Cluster Task Force, likens his country's approach to looking at a forest and trying to find the clusters, not the trees. Meanwhile, he believes the Western world was getting distracted by the trees and got lost among them. Rewat, have we here in Canada been too focused on individual infections versus clusters of infections?
Absolutely, yeah. And South Korea is a great example of this. They have a fantastic system. I mean, it's a really robust, complicated, comprehensive system using all kinds of tools for contact tracing, including tracking credit card usage for understanding where people have been recently, using cell phone data to track mobility and so forth. They also have a QR code system where if you go into a business, or a nightclub or a bar or something or a shop, you have to scan the QR code, and that creates an electronic log that you have been there. And that's kept for about 4 weeks. So in case there is an outbreak, we can figure out all the people who are likely part of that clustering event. So here in the West, we do forward contact tracing. That's where you identify someone who's infected and then figure out who they then came into contact with after they became infected. And that you get, a fair number of cases that way. But if you can go backwards and figure out where that first person got infected in the first place, they were probably part of a cluster. So we identify that cluster and then see other people in that cluster and follow them. So there was a fairly important paper by Endo, I think it was, at LSHTM, that suggested that using forward contact tracing more robustly and just identifying more contacts, you can increase your case count by 15%, the number of people that you catch. But backward contact tracing, going backwards and finding the original cluster, you can increase the number of infectious cases you identify by 2 or 3 times. That's huge. That's an enormous policy lever, and probably why some Asian countries who do this are able to, again, have a kind of pseudo-normality that we have yet to acquire. But it does come as a cost. And I mentioned that there are some privacy issues there. You have to have a compliant population that participates in this endeavor. We have to agree to use the QR codes. We have to agree to be tracked. And also you need a really good testing system, because you have to test these people once you find them quickly enough to prevent them from spreading on further, and a strong isolation procedure as well. So it requires a rethinking of our infrastructure overall.
And just to go on what you were talking about with the backwards contact tracing, Ashley, can you give us a definition? What is backward contact tracing?
So basically, it's turning contact tracing a little bit on its head. So the way that we typically do contact tracing is, again, exactly as Raywat just described, is you start with your initial case that you find via testing, and you ask them who they've been in touch with, up to 2 days before they had symptoms and over the time during which they were infectious. And you find those people who are contacts, and you isolate them, and you get them tested. And you basically, what you're trying to do is interrupt these chains of transmission. With backward tracing, what we're saying is when we have that initial index case, we want to know, was that person the contact of a case that we've already identified? And if not, how did that person get infected? So what we do is we look backwards for a longer period in time, and we try to identify, where that person was, what was the most likely place that they were exposed at. And then once we find that potential exposure event, we sort of identify people who were also at that venue or associated with a particular activity, and we do forward tracing. So you basically are doing this sort of backwards and forward dance, but the idea is to really look backwards in time to find those risky activities, risky venues, so that you find more cases. And the idea is that you just get a higher yield because this disease clusters so much. Once you have an initial case, it's highly likely that they're associated with a larger cluster. And if you're able to look back in time and do this backwards contact tracing, you could potentially find more cases and interrupt more chains of transmission.
I was actually going to say that I guess what we're doing here in the province is forward contact tracing, but Ashley, you did say that. So I want to ask you both, do we need to change how we do contact tracing in this province? Raywat, I'll go to you first.
Yes, absolutely. If a vaccine is months away, if not years away, and we haven't got a treatment yet, and we want to avoid economic closures, I think there are lessons to be learned from Asian countries who seem to handle this better than we do. And of course, they have other cultural differences that make it possible for them to do this. But yeah, I think if we really strengthen our TTI, or testing, tracing, and isolation regime, we have a really good chance of having a better handle on this. That means backwards contact tracing. It means hiring more contact tracers. It means empowering them to do things that currently they cannot do, like using electronic data for tracking and so forth, maybe even social media crawling. And it means investing in more testing capacity for that faster turnaround once you find cases. Yeah, I think this is how we have to do this going forward.
And Ashley?
Yeah, no, I agree 100%. I think the one thing that's important to note is that backward contact tracing is really, really effective when you don't have large numbers of cases. So it's most effective, early on in the epidemic when it's starting to grow. And again, towards the tail of an epidemic or the tail of an epidemic curve, when case counts are low again. When you're in the midst of high number of cases, which is where we are in Ontario right now, and where we're struggling to keep up with even basic contact tracing, the effectiveness is going to be harder. And so, I have a lot of respect for people who are doing contact tracing right now because, their jobs are incredibly difficult. So I do think that there's huge value in doing backward contact tracing, but we also need to be cognizant of the workload that's involved. And again, provide, I think, innovations in terms of, how do we do this? How do we support the people who are doing contact tracing? And also, I think the other component of that test, trace, isolate is support. We absolutely, I don't think we have enough conversations about this in terms of, when people are identified as cases or when they're identified as contacts, we really need to make sure that they have the supports that they need to be able to self-isolate and be able to adhere to all of the recommendations that we're suggesting.
Kind of like having a place to stay for quarantine, etc. I know
Exactly.
I know some people listening to this, and there's a lot of frustration all around because we do know that right now we're using a contact exposure tracing app, and in the past few days we know that not many people are using it. So do you see, if we are to take on the backwards contact tracing, do you worry that that's going to add on another layer of confusion around this whole COVID-19 situation? Raywat?
It's possible, absolutely. And messaging around this pandemic has been a problem from the start. Getting buy-in from the public has been an issue. Getting clarity in what we expect from people has been an issue as well. But this is the nature of our game. We're in chaotic times and unprecedented times. But again, what we see from places like South Korea and Singapore and Japan is that the QR code system seems to be easier for people to handle because they take out their mobile phones and they scan the QR code at the entrance of a place, and they're done. But that requires people to have a phone with the appropriate technology attached to it, and it requires people to actually do the thing we ask of them. So public compliance is very important. And I hope going forward that we make investments in assuaging people's concerns and getting the citizens on board as partners in this endeavor. This can't be done from a top-down process alone. It needs buy-in from the people and leadership from the people as well. This is a democratic process. Pandemic control is a democratic process.
Well, when we talk about super spreaders, do we know how that happens, Raywat?
Wow, that's a good question. I think about the Swiss cheese model. Different slices of cheese have different holes in them, and you need all the slices to line up just right to get like a hole right through. So you need several things to line up just right for a super spreading event to occur. And these include characteristics of the virus interacting with the infected individual, and most importantly, in my opinion, characteristics of the environment. So is the infection upper respiratory or lower respiratory? How far along the infection disease cycle is the individual? Are they symptomatic or non-symptomatic? Are people around them resilient? Are they older or younger? And the environment. So is it a crowded place? Are people wearing masks? Is there alcohol involved to reduce the ability of people to make rational choices? Is there good ventilation? So all these things matter, but they're happening so frequently that, by chance alone, the cheese slices line up more frequently than you think. And that's how we get these super spreading events. So we never know which event is going to be a super spreading event, but we have a good idea of the environments that are amenable to super spreading occasions. And that's a good thing. It means we can identify those likely scenarios and take them off the table in times of caseload increase, as we've done in Ontario recently. I think closing some businesses was a wise thing to do because those are likely super spreading opportunities.
And Ashley, are some individuals super emitters of the virus?
Yeah, so again, it's a complicated question. I have a colleague, David Fissman, who refers to super spreader events as the Lemony Snicket series of unfortunate events that leads to a super spreader event, because it's a combination of the individual. Over the course of an infection, people emit different levels of virus. So people tend to be most infectious around the time that they develop symptoms. So if you happen to be out at that particular time, you're more likely to transmit than at another stage in your infection. Similarly, different people have different viral loads. So some people are more infectious than others. But again, the other sort of piece that goes into this is the environment. So where are you? If you're staying home, even if you're generating large amounts of viruses, if you're not seeing other people, you can't really have a super spreader event. So again, it's really this confluence of various factors that's really important for generating super spreader events.
And obviously not to make light of it, but like a series of unfortunate events in a way.
Exactly. So you sort of have to be at your peak of infectiousness, and you happen to be out at a restaurant that has poor ventilation, and you happen to be in close contact with a lot of people, or the air conditioning is blowing in a way that you cough and your virus particles are spreading into a bunch of other people. It's really, these series of circumstances that, some of which we can control, but some of which we can't necessarily predict ahead of time.
And what about kids? Are kids super spreaders of the virus?
That is the controversial question that will get us both into trouble, depending upon who's listening to this. Some people say no, and some people say yes. I say yes, they are. And Ashley actually tweeted a study just recently from SFU that found that most kids, when they're infectious, do not cause clusters, but some do. And the problem with those that do is kids are more likely to be asymptomatic. So they're stealth infectors. And these stealth infection events can cause clusters that are more difficult to detect. And you start out the show by citing this India study that looked at 3 million people, and they found that children who are infected have just as many first-order infected contacts as adults. So kids and adults have equal proportions of infectivity and equal likelihood of infecting others. And now we have kids in schools all over the world. Now, the good news is that the number of school outbreaks is probably less than some people expect. It's not the apocalyptic event that some had projected. However, school outbreaks are happening. In the UK, they've had scores of school outbreaks. In France, there are more outbreaks in educational settings than there are in workplace settings. So yeah, the answer is yes. Kids can be super spreaders, in my opinion.
I'm sorry, I didn't mean for it to be a controversial question because, kids haven't been in school for a very long time and, kids are going to school. So I'm surprised it is a controversial one. But so Ashley, are kids super spreaders?
So I'm going to hedge this a bit and say, I'm not really comfortable with calling children super spreaders. I would say children are associated with super spreader type events.
Okay.
So we know that children can get infected. We know that children can transmit the virus. And we have growing evidence of super spreader events happening in schools. But again, it's that combination of children are infectious. They can be infected with the virus. I think the biggest challenge is that they can be infected and be asymptomatic. So we don't necessarily know it. And again, schools are an example of a really good environment for spreading COVID-19. We have closed spaces with poor ventilation. You have lots of people together in a crowded space. In the absence of masks and in the absence of physical distancing, you have a lot of people who are talking often very close to each other. So again, I think schools are absolutely showing to be environments where super spreading can event. And so, or super spreader events can happen. So, I would say kids are associated with super spreader events. I hesitate to call children super spreaders because I don't think there's something unique about children that makes them transmit the virus.
It's the environment
than other people.
So it's the environment. I think, again, we've talked about messaging and, people, we've talked about what's happening in Ontario, about the class sizes being bigger than what scientists have suggested. But we've had that conversation already. So Ashley, for the average person trying to go about their day, heading to the grocery store, maybe even considering going to the mall, using public transit, what does our understanding of super spreading mean for the level of risk that they should feel?
So I think one of the challenges with the idea of super spreading events is, on the one hand, it's a little bit reassuring. You hear this and you say, well, most people are not going to infect anybody or they're not going to infect a lot of people. But the challenge is we don't know ahead of time who those people are and what the circumstances are. So I don't think that we should go about our lives necessarily feeling more comforted. I think, though, given what we know about the sorts of activities and environments that facilitate super spreading, I think we can use that to guide our day-to-day activities. So the Japanese have what they call the 3 Cs, which are closed spaces, so indoors, crowded places, and close contact settings. So settings where people are close together, talking and singing. And I think that can really help you guide your day-to-day activities. So, if you're going out to a grocery store, you're wearing a mask, you're keeping your distance from other people, you're not spending a lot of time indoors. That's not a high risk interaction. By contrast, having 10 of your closest friends over to your house and, doing karaoke is a high risk because you have lots of people indoors, you're singing. And so, thinking about those different factors and understanding that those 3 Cs can really sort of help us predict the sorts of environments that are higher risk. I think that can help us sort of navigate our lives, recognizing that, we can't all stay indoors forever and we need to go out and we need to live our lives.
And Raywad, I'll ask you the same question.
Yeah, it doesn't change what individuals have to do. We have to keep our distance from people, wear a mask when we can't keep our distance from people when we're indoors, and avoid social gatherings we don't need to go to. Now, individuals may be called upon in the future to participate in these backward tracing endeavors, meaning using QR codes and so forth. So that's where citizens can do their part. But the super spreading thing, I think, has more relevance for managers at the public health level to allow us to figure out which opportunities to take off of the table at a societal level. So again, for people, the average citizen, just keep your distance and avoid social gatherings.
And I want to go back to that when we're talking about clusters. We know that there's been a lot of cases in congregate settings. We're talking about schools. We're talking about long-term care homes. Ashley, could we test wastewater to help detect clusters of infections?
Yeah, I think that the wastewater stuff is turning out to be a really effective tool right now. So Ottawa's started using it. I think other parts of the province are starting to use it. And it shows that it does track what's happening in the community. So I do think, particularly in congregate settings like in long-term care homes and in schools, there's huge potential for this as another way to basically get a handle on what's happening, rather than simply relying on reported cases, which have become clear are really, really challenging to interpret as we start changing our testing policies. So I do think it's a really important stream of data. Having said that, I think we're still trying to figure out exactly how to interpret it and what some of the nuances are in terms of how to act on that information. But I do think there's a lot of emerging evidence that it is an effective tool.
Rewa, I'm going to end with a big question. We only have about 30 seconds. But to what extent is COVID-19 still a bit of a mystery to us?
Oh, well, it's a huge mystery. We still don't know where it came from, really. I mean, to some extent, I'm hearing rumors that there's evidence that may have been with us longer than we thought, like by weeks or possibly months. We don't know its effects physiologically as well as we could or should. And we don't know about immunity. And that's relevant for developing a vaccine. But epidemiologically, we're getting a handle on transmission dynamics, which is really good.
And Ashley and Raywat, that's all the time we have for now. Thank you so much for your insight. And Raywat, I know you've been on this show before, and Ashley, just wanted to say you were terrific. Hopefully you'll come back on the show.
Thank you so much.
It's certainly not funny, but for many in rural Ontario, inadequate internet access is something of a running joke. That's part of what assistant editor at TVO.org, Ashley Okwosa, found as she looked into this story in Eastern Ontario. She's with us now from the west end of Toronto to explain. Welcome to the show.
Thanks for having me.
All right, so there were two takeaways from your piece on TVO.org. One was I take my internet access for granted. Two, there are some parts of this province that are still sort of in the dial-up age. You spoke to families who are juggling the homeschooling and the working from home. Tell us what you heard.
So I spoke to two families in Duro-Dummer, which is a township in Peterborough. And, both families said that they've been having issues with connectivity, internet issues for as long as they can remember, some for as long as they've lived in the township. So what we were seeing was just that this was these issues were exacerbated by the fact that everyone was working from home. So one family went from having, one person work from home maybe 1 day a week to 4 people working from home and trying to go to school or Zoom classes and things like that 4 to 5 days a week. And, one family, they actually had to stagger when they would get on the internet. So maybe like the parents will be doing calls at one time and students will be, or, their kids will be going to school at another time. For another family, cost was such a major issue because if they did go over how much internet access they had, they would have to pay anywhere between $400. So, this woman that I spoke to, she kind of mentioned that she was rationing her internet. So it really is different from, what a lot of other people experience, but it is a reality for many families in several parts of Eastern Ontario.
I want to talk about broadband demand in Eastern Ontario. Sheldon, can we bring up this map and actually tell us what we're looking at?
Yeah, so this is a map from the Eastern Ontario Regional Network, and it's just mapping out demand in the region. Pink, there are a few pink dots here, and that shows that there are about more than 20 household equivalents between 1 square kilometer. Blue, green shows that there are anywhere between 2 to 20 household equivalents between 1 square kilometer, and then blue shows anywhere between 1, and then white is where there's no demand. What this map doesn't show is that about 46% of households in the region have access to 5010 megabits per second, which is the minimum required internet speed by the CRTC. And if you add, urban communities in the region, it gets to about 63%. So it still shows that there are, a significant amount of people who don't have access to the minimum required speed.
So let's talk about that. What exactly makes up a functioning broadband connection?
So my reporting, I kind of came across 3 things that people were talking about a lot. So that's upload speed, download speed, and latency. So upload speed, as the name suggests, is really how quickly you can get information from your server or router to an external one. Download speed is really, the opposite, right? How quickly you can get information from an external one down to yours. And latency is really the speed at which data transfers from different sources. So a source that I spoke to in my story kind of described latency as traffic. So, if there are a lot of cars on the road, it's harder for you to travel quickly. And then if there are less cars on the road, it's easier for you to move. So things like upload, download, and latency affect things like video conferencing, right? So if you do want to go on Zoom and have your audio and video on at the same time, those are things you have to think about.
It sounds like a dumb question, but why is this problem so complex? Why isn't there an easy fix here? Put up some towers.
I think it's a good question. I think a lot of very smart people are still trying to figure out. But what I did gather was that it's just really expensive. Someone kind of mentioned that getting broadband access across the province and even across the country would really be a multi-level partnership, and it'll involve, everything from the federal government to the provincial government, smaller, private partners as well. And, EORN, for one example, has kind of estimated it to cost about over $1 billion to get 1 gigabit per second to parts of Eastern Ontario. The province has, put forth a 5-year investment of, hundreds of millions of dollars. And then there's the Universal Broadband Fund, which is at, $1.7 billion now. So I think it's really expensive, and it just does require a lot of people to come together to make it happen.
One thing that we've seen with this pandemic is some call it an exodus, some are calling it a movement out of the big city into these rural communities. What does, having a good internet connection do and have for these municipalities when we talk about an economic effect or impact?
Yeah, I think that did come up when I was talking to one of the counselors at Durham, and she kind of mentioned that a lot of people are, yes, like you did mention, a lot of people are making, this move to rural communities for whatever reason, but they are kind of, before they make that decision, internet is something that they're taking into consideration, right? So she said before people moved into communities, they would say, oh, I wonder what the schools are like here. But now, people are doing that in addition to schools and other things. They're thinking, I wonder what the connectivity is like here. This didn't make it into the story, but I spoke to someone from the Federation of Ontario Cottagers Association, which represents, community organizations across, the province, hundreds of municipalities across the province. And they estimated that these waterfront communities or cottages in rural parts of Ontario bring in about $75 billion in property taxes. So that's, thinking about that number being at stake because of internet connectivity is pretty significant.
Yeah, very big number. Ashley Okwosa, I want to thank you so much for joining us on this show today. That's Ashley Okwosa, assistant editor at tvO.org. Thank you again.
Thank you for having me.
The agenda this week learned about the opioid crisis in Northern Ontario, spoke to the New York Times' Nicholas Kristof about the decline of the American working class, heard from columnist Barbara Emil on her tell-all memoir, and assessed Hamilton's efforts to connect urban renewal while fighting climate change. The agenda's Week in Review begins asking whether we really need politicians anymore.
Canadians were asked what they thought about this statement. Elected officials care about what ordinary people think. Only 24% of people surveyed agreed with that statement. 59% did not. Almost 60% of people surveyed pre-COVID thought our democratic system does not represent them well. 60%. Vass, start us off. Are people right to think that way?
I think they're right and they're wrong at the same time, because the primary technology that we use to find out what people think or how they feel is polling, and it's very impersonal, right? So it doesn't surprise me that because we rely so much on polling, people then feel that there's an inauthentic connection with their elected officials. The flip side of this is that there are so many technologies out there and technological options where if we were to invest more in our deliberative infrastructure, we could do a better job actually talking to people and help politicians who are fundamentally kind of platforms of the pulse of the people do a better job doing what they're supposed to do.
If I look in the province of Ontario, Cliff, since the end of World War II, we have had the same political parties in this province exactly. We've had Liberals, Tories, and New Democrats since the end of World War II, and one Green. In the last election, we got one Green, and that was the biggest change. Whereas if you look next door in Quebec, or if you look in Saskatchewan or British Columbia, you've got new parties coming and going all the time. We have a very traditional, established way of doing politics in the province of Ontario. Now, I don't know if that reflects contentment or if it reflects a sclerotic nature of our political system that just is not open to changes. In which case, pick up on that if you would. What do you think that portends for us? Cliff, that's for you.
So I suggest that it's a reflection of the dynamics of power and the structures of power in the province of Ontario more than anything else. I absolutely agree with Vass's point that I think there's an appetite for change. How that change manifests, the form it takes, is unclear to I think to most of us and to most members of the public. But I do think introducing these interesting ideas about alternate forms of governance at least opens up a public discussion, a conversation around what the current problems really are with democratic representation in Canada and in Ontario. And perhaps the solutions are far-fetched, but I think that's the point of these thought experiments, to get us thinking about what the future may hold. Representative democracy is a very old concept. It goes back to the Roman republics, so it's not this notion that it's going to change overnight, but that we can introduce new ideas and nuanced ways of thinking about it in order to try and address some of the deficits that we've identified and have been trying to improve upon for decades.
Gary, how open do you think the Canadian public are, or for that matter, how open do you think official Ottawa is to entertaining some of these new and different ideas?
Well, just to go back a little bit to the last point, which I think was really important about Ontario, is I think it's not just a Canadian political culture. There are regional political cultures that do accept a little bit more, loose fish randomness in the political culture. I think of BC, I think of Alberta, where even at the federal level, BC has been more likely to elect independent MPs to the House of Commons than Ontario has. Official Ottawa and the party system is, highly resistant to change, and these things take a lot of time. But part of the reason is, and I wanted to touch on this, as people talk about, well, MPs should be more independent and speak out. And I think if you, even against their own parties, and I think if you talk to people, MPs who have done that, they realize it's not a panacea. They speak out and they say, well, I actually, feel very different than my party on this issue. I'm actually opposed to my party on this issue. And what's the reward for it? Oh, there's a media story about how there's division in the ranks and this person is off in left field, and partisans from the other side say, there's a split. The leadership is weak, right? So we can talk about a lot of independent thought, but the reality is that official Ottawa and the structures that are in place are very resistant to change.
Vass, you want the last 30 seconds on this?
I mean, sure. Like, what if those independents had the data behind them to say, listen, I'm this conduit for my riding. This is the information I have. This is the deliberative work I've done. And now doing my best job to represent them and layering in, my own thoughts. This is kind of the data-driven approach to dissent that I'm taking. I think that's what we want. We don't want politicians to be swinging around kind of independently, not on behalf of anyone but themselves, making policy and making decisions. That's not the point.
How has this story changed post-pandemic?
So it's created a real lack of resources and services within the community. There has been a lot of agencies that have stepped up to try and do what they can with the resources that they have. But at the same time, too, there is no way to introduce policy and protections and precautions without taking some sort of staff resource away. So because of that, people accessing things like food banks, soup kitchens, even just a place to stay out of the rain for a little while has been an increased challenge. In addition to even a lot of the resources that they get from some of these agencies. So things like the amount of food that they get in a day. So currently, our executive director just kind of went out a little bit of a walk, kind of walking a life in the day type thing as she went on her breaks throughout the day, tallied up the kind of receipt of services as to how much a person actually gets. Big highlight of that as to not only just how far someone has to walk to be able to access all these little services that have kind of been satellited out over the pandemic. It's also decreased the amount of quality of services, so things like food. So she added up the calories for the day. It was 8,500 calories that a person would consume in a typical day on the street. So that's over quadruple the typical intake for your average male. But at the same time, too, it's mostly out of fibers and sugars that you won't see most of those calories through the day. And for a lot of folks, the lived experience of this is just feeling constantly, repetitively starving throughout the day. Sugars don't last you very long, and there's not an awful lot of those good fat protein meals that people used to get quite easily through the soup kitchen or elsewhere.
Anne Marie, pick up the story if you would. Since the pandemic hit, how has that changed what you do?
So we are very lucky to be able to, the fact that we're able to be adaptable with our program because of the land base. So we're one of the few treatment programs that were able to stay open during the pandemic, and we've had people with us right throughout. Those that were with us on March 13th were able to complete their program and probably quarantine for the longest because they were in the wilderness for that entire time. So we're very fortunate in that way, but there's no doubt that wait times have become an issue. We've had to change the program from a continuous intake, rolling intake, to a cohort. So we've had to put into place quarantine as well as withdrawal management camps, just to ensure that people weren't coming in with signs and symptoms of COVID-19, and we were able to protect everybody in the program, but also in our communities and on Manitoulin Island, and make sure that we were mitigating that when we had people coming from across Ontario to our program. So that was a big one for us. What we're hearing from the participants themselves is, before getting here, COVID-19 was very difficult for them at home because they're sitting with their feelings. And for people with addictions, that can be the hardest thing to do, and often leads to, to more usage when you have to sit alone with those feelings and you're not able to get out and about to different programs and to distract. So that's definitely one of the negatives that we've seen. And I think we're seeing right across all organizations that service with mental health.
Let's talk about healthcare for a second, because this is something that we Canadians feel, I think, rather smug and superior about. There's not much in this world, maybe healthcare and hockey, that we feel smug and, superior about, but that's surely one of them. Let me steal this from a recent column that you wrote for the NYT. The United States ranks #1 in the world in quality of universities, but number 91 in access to quality basic education. The U.S. leads the world in medical technology, yet we are number 97 in access to quality health care. So much of the negative stories that you tell in your book stem from the fact that you guys don't have, too many Americans don't have access to the health care that they need. Let's put it that way. How can a country which is so accomplished in some aspects be apparently so disinterested in others?
So I think that it goes back to the 1970s. And I think, at that time, the U.S. was about average among advanced countries in terms of health metrics. Canada itself was then just kind of beginning at the provincial level to work its way toward national health care. And then other countries surpassed us in educational investment, in healthcare, in building social support mechanisms. And meanwhile, the U.S. developed two narratives that I think were extraordinarily unhelpful. And one was that government can't do anything right. And the other is that it's all about personal responsibility. And when people struggle, it's about their bad choices. And they should be blamed for their struggles. And other countries, Canada included, did not have those narratives. And I think that made them more likely to reach out and help people, whereas it made the U.S. less likely to do so in ways that hurt not only those individuals, but our country as a whole.
Let me do a follow-up on that, because, we haven't got a perfect healthcare system here by any stretch, but nobody loses their house because they can't afford to pay for an operation here. You have a line by Walter Cronkite, the great anchor in your book, which I think is terrific. The American healthcare system is neither healthy nor caring nor a system. Explain to Canadians who may not understand, because we don't have this here, how healthcare and lack of access to it can be a leading cause of bankruptcy and therefore, complete humiliation and the end of your life.
Well, I mean, we in the U.S. have the worst of all possible worlds. We have the most expensive healthcare in the world per capita, extremely expensive, and yet we don't have broad access. And so if you're one of those millions of people who doesn't have strong insurance coverage, then you're stuck with bills that are just completely unpayable, and that is, as you say, a leading cause of bankruptcy. And it's not just, we often talk about medical insurance, but it's also dental. About 30 million Americans don't have medical insurance. About 78 million don't have dental insurance. And for Tightrope, we visited, I describe a man who was getting free dental care. He had 20 teeth being pulled at once. 20 teeth. How does that happen? It's mind-boggling. This should not be happening in an advanced country. And yet here the U.S. is with some of the best medical technology, and you have these situations, even kids in America. A child in America is 55% more likely to die by age 19 than a child in other OECD countries. That's not because that child is making poor choices. It's because we as a country in the U.S. are making poor choices.
We'll establish the following. We talked about the fact you didn't divorce, quote unquote, well in the past, and therefore you came to your marriage with Lord Black with very little money, and suddenly you've got this quite wonderful lifestyle, and we should say, you don't shy away from the most famous quote you ever uttered in the book to that Vogue magazine reporter, "I have an extravagance that knows no bounds." But I want to read an excerpt from the book now, and then we'll come back and I'll ask a question on the other side of it. As it was, you write, I sat listing our errors and our offenses as honestly as I could to make sense of it all. I clearly had an offensive, smug, and abrasive personality. We had been too blatant in our enjoyment of what Conrad calls the preferments of his position. There were just too many photos, too many pictures of us enjoying ourselves all over the place with important people. Hear Conrad on the radio, see Conrad being made a peer and complaining about the loss of his citizenship. See Barbara prancing around on the social pages of the New York Times. Read her fey comments about extravagance and clothes that gave Conrad's enemies an open sesame. People were simply tired of us, tired of our being and our bloody self-importance in the pronouncements we made verbally or in print. I guess I want to pick up from that and say, do you think that a lot of the eventual very zealous prosecution of him by law enforcement authorities was in part, because of what you two, well, okay, you. I wasn't going to say it, but you just said it. Yes.
No, let's not shy away from it. And before I answer that, I'll say that I'm having some difficulty with publicizing this book because I'm afraid the same loop will start again. There's too much of me pushing this book. There's too much of me on television. So it's getting increasingly painful to do these interviews. I'm just afraid of starting that off again. I think that Conrad would probably have had to go through the same awful times again without me, but I think that I started it off and made it so much worse. When I gave that interview to Julia Reed at Vogue, who was a wonderful journalist who died just a couple of months ago, and she quoted it absolutely accurately, and then she wrote letters to newspapers saying she was just making fun of herself, begging them not to keep hitting me over the head with it. But I did make it. It was accurate. I did spend money. It was amazing to me. I mean, I had never had this freedom. I'd always had to earn my money, whether I was married to someone wealthy or not. I'd always had to look out for myself. And suddenly, here I was in this glittering world, and attached to people who, by their nature, had their picture in the papers. I think that my extravagance became something that other journalists could use to beat us over the head with. So it ignited a media firestorm, and that in turn created or added to the atmosphere around Conrad. It was a time, you remember, when American prosecutors were looking for high-profile heads because of the Enron and WorldCom bankruptcy. Everybody wanted to have a conviction to get the next level as a prosecutor. And I think that the media firestorm around us helped get that prosecution going. It's an interesting thing because it started out not as a battle over how much money Conrad was making or whether he had stolen money. It started out simply, and this was really the basis of the whole thing, as one large investor wanting Conrad to sell the Telegram, break up the company, and thus realize the value of the stocks. Conrad thought it hadn't reached the point where it should be broken up. Personally, I think he just didn't want to sell the Telegraph either, but that was the basis, and the only way the investor could get the company broken up was to get Conrad out of the company because he had the voting stocks. And the easiest way to do it in that hysterical atmosphere was to accuse him of wrongdoing. Because just like with the Me Too situation now or the cancel culture, you don't have to prove anything. You just have to say they did something wrong, and then the person's finished.
We had my goodness, it was just an excellent program on late last night on TVO called The Life-Size City. And normally, I mean, that's a multi-part series which normally focuses on some of the biggest cities in the world. And last night's show was about Hamilton. They were looking at mid-sized cities last night, and they put the accent on Hamilton. And, well, let's look at a clip from the show, and then we'll come back and have a chat, okay? Sheldon, the clip, if you would, please.
This street is King Street. You see that it's about 5 lanes of traffic all in one direction. This is probably a 4th body blow we took. And I think it was 1952. They just overnight changed all the streets to one way. Oh, wow. They thought that was a great way to renew a city. Facilitate the automobile traffic, and the rest will follow. So there's been a lot of initiative and lobbying over the years to change main streets in Hamilton back to 2-way. It would really help to slow down traffic, to create an environment where people might feel comfortable again.
It was on last night, and if you missed it, it's on again tomorrow night as well. It's really must-see for people who are interested in how cities work. But boy, oh boy, I mean, I lived in Hamilton from the beginning of my life until age 18 when I moved here. And those one-way streets, I mean, people have been fighting about that for decades. So let's get into some conversation about this. Beatrice, in terms of what's good for the environment, what's your view on the one-way street issue?
Absolutely, 2-way makes sense. The research shows that there's more vibrancy, traffic is slowed, people are feeling more capable of walking without fear of, the speed in traffic. Businesses thrive. We see, I think it was a decade ago, where James Street was converted to 2-way, and you can just see that the vibrancy that's happening there. I must say, though, there is in Hamilton specifically, we have the issue of industrial trucks that are kind of barreling through neighborhoods, and I think this is right now we're going through a kind of a review of the truck route system, and you'll find that in many of these cases this kind of adds to the pressure on these streets, on these one-way streets as well. It's just a terrible way the quality of life is very much impacted by that kind of situation. So we're pushing as Environment Hamilton to kind of really engage the community and we're hearing from the community that they don't want this. They don't want this kind of, they want the slower traffic. They want that a 2-way street can bring that doesn't have an 18-wheel industrial truck barreling along through it. So, and polluting the air and really, really compromised, to Mary Lou's comment about the need for the good, healthy green spaces. We're talking about many areas in the city that have very poor tree canopy coverage, and all this combined adds to a terrible air quality, and we really need to change that if we're going to be addressing, if we're talking about climate and environment here and livability.
Well, of course, the one good thing about the one-way, there may be more than one good thing, but certainly one good thing about the one-way streets is that you really can get from one end of the city to the other end of the city very quickly. And unlike in Toronto, all the lights are synchronized. So once you get going, you can just keep flying. Now, it's great if you're in a car. Maybe, Maureen, you could pick up the story here. It's great if you're in a car, but if you're trying to actually create a little street life and environmental sensibility, not too good for that, I guess, eh?
Yeah, I have nothing positive to say about our one-way streets. So let me just put that out there. You can't have a vibrant, fair, livable, sustainable city when you have the likes of a 403 going on both sides right through it. So if you want to drive through your city efficiently, and that's what it was designed for, and to get workers down to our industrial and manufacturing water front, yes, it is the most efficient way in which to move transportations, but it's a way in which you can kill your city, and it's been disastrous.
That's just some of what we covered this week on the agenda. For more, including the full conversations, you can visit our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's it for this Friday, October 23rd, 2020. Next week, we're exploring what governments can do to get the economy to bounce back. Ask whether Canadian expats could be an untapped overseas resource for their home and native land. And debate if it's time for this country to leave the monarchy behind. I'm Nam Kiwanuka. Thank you for watching TVO and for joining us online at tvo.org. Have a great weekend, and Steve will see you again on Monday.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman. And by viewers like you. Thank you.
The Agenda is always on. To catch up on conversations from this week or any week, visit our website, tvo.org/theagenda, or our YouTube page at youtube.com/theagenda. It's all there for whenever you want to watch.